I first started working with people with a disability when I did my honours thesis in the early 70s, and at that stage was looking at children with autism and children with intellectual disability and understanding their language. At that point, there wasn't a lot in terms of rights or attention to how people might live well in the community. Subsequent to university, I've worked as a psychologist in schools, in early intervention with young children and families, have managed a disability team, an intellectual disability team, have been a regional director, so that meant actually responsibility for disability, child protection, criminal justice, youth justice, and a variety of other human service type circumstances, which interestingly is relevant for a lot of people with a disability when their lives don't go well. I've also taught at a university, and then for the last 20 years have worked as a resource person, as I would describe it, with organisations, with government, with universities, hopefully furthering opportunities for people with a disability. I think one of the challenges for this field has been truly understanding and paying attention to what's happening to the lives of people with a disability and their families. It's one of the it is the only probably rights movement that, particularly for people with a cognitive impairment, that is driven by those other than the individuals themselves with the disability. And I think sometimes we make assumptions. Some of those assumptions are good assumptions, and sometimes I think we don't know enough about what the experience of disability is for people, and in many ways that's what we've wrestled with for decades. Common experiences with different organisations. I think one of the common experiences with different organisations with government is a belief that some simple ideas, people should live well in the community, are straightforward, are easy to implement, and will just stick and continue to happen. And I think what I'm learning the most with my work and looking back and some of the challenges that still remain is that this isn't quick, and we do people a disservice when we think it's going to be, either through short-term initiatives, short-term effort, short-term public policy, short-term funding. We run the risk of actually losing ground each time because the directions we're talking about aren't easily embedded in society. The three most common limitations, if I can think about it, for people with an intellectual disability, and I guess in particular, no, it's children and adults, it applies across the lifespan. Two of them are related. One is overestimating what people can do and therefore under-supporting them in a variety of situations because people have the right to do things, so let's just give them that opportunity. And I think we learnt that with some of the early closing of the institutions, where we believed that passively if people were in the community, then their lives would automatically improve, and we've learnt that that's not true. People need assistance, whereas it was first understood as a very passive process. Change the environment, people will thrive. And the flip side of that, the glass ceiling for people is in fact underestimating what they can achieve. And again, one of my learnings as an example there would be some of the advocacy, self-expression opportunities that people have. And when I first started doing independent consultations with people with a disability, very initially it didn't happen at all. The consultation meant speak with their family, speak with anybody else, but not the people themselves. Increasingly, the notion of talking directly with people, again, decades ago, started to gain traction. And what I would find in those meetings was initially people wouldn't talk at all. A few more years passed, people would talk, but you never knew what they were going to say because it wasn't on topic. A few more years passed and decades, and people know they're there to talk and that they have a message, but it's taken that long. So again, overestimating, underestimating are both parts of the glass ceiling. I'm really excited about the NDIS. It offers some fundamental changes for all people with a disability that doesn't exist in the system now, and that is lifelong certainty about receiving funding and the opportunities that flow from that, that it is the funding, but it is the certainty for individuals and families to plan their lives so there aren't big changes in what might be possible simply because somebody's become a bit older and they move into a different funding regime, and therefore what was available for children isn't available for young adults, isn't available for older adults. So hopefully it will see the removal of all of that. It is very much rights-based in terms of individuals and their supporters, often families for people with an intellectual disability, making their own choices as much as possible with the right support, which is what I think as much as possible means. And it is well funded at this point, although that could change, and it may change. But I don't think it takes away from those initial fundamental improvements about a national system with certainty and lifelong entitlement. I'm interested hearing some of the concerns emerging about the NDIS, and they're valid, about is there going to be enough support? Is it the right support? What does reasonable and necessary mean as an eligibility criterion? But, and I think we have to fight to be sure that those things are really wrestled with and mean different things for different people and different support needs. But the system at the moment is appalling. And I don't think we should lose sight of that. And I think some of the debate about, oh dear, what if the NDIS does this, fails to recognise the fundamental changes that are actually occurring as part of it that will improve some of the real shortfalls in the system at the moment, which is a lot of people who should be getting support aren't, that it's unequal across the different states, it's unequal in different geographic areas, and there is that split at different age levels. So we're solving some things, we're not solving everything. The other bit about the NDIS that I think is really important if we capture it properly is because it's an insurance-based system, that actually means the insurance people care about long-term outcomes. Now, we should all be caring about long-term outcomes. Our challenge is to make sure those actuarial staff, financial, lifetime monitoring people are caring about the right outcomes. But there is a huge incentive within the scheme to make sure that how money is spent, the support that people get makes a difference in their lives. Now, it's ironical that we needed the finance people to tell us to do that, because up till now we haven't been able to sustain that or even have good ways of keeping track of people's lifetime support results. The Productivity Commission, which was the precursor to the NDIS legislation and design, identified very clearly that the NDIS is for everyone in Australia, and I think that's one of the clear messages that we are at risk of losing. So none of us hesitate about insurance for driving a car, for some sort of housing insurance in case the very unlikely event that the house burns down. I don't believe that the general population has any hesitation about the notion of insuring against somebody having a disability within the family. And in fact, if you look historically to the increase in the Medicare levy that happened a couple of years ago, was 0.5% or whatever the number was, but that really went through without a murmur. The general public understood that, and that was a reasonable increase in money that the government needed for all Australians. So that would be my one simple message for parliamentarians and public servants. This is something for all Australians. In the second instance, it is something that is good for all services, because the response of mainstream state services, health, education, housing, etc., will in fact be assisted by thinking about the issues for people with a disability. And in fact, the bulk of people with a disability won't get direct support funding. They never have, and they won't. They don't in the current system. The bulk of people have a mild disability, and they are best supported within the mainstream system. The people who will get direct funding, still a substantial group, still more than are funded at the moment, are the people for whom the mainstream system can't do that extra little bit of adaptation. And so we end up with a much stronger system for everybody if our mainstream services are adaptable and we find really good ways of including people with a disability who have higher support needs. The issue of informed consumers, I think, is a really important one, because the NDIS is built on expectations that people with a disability and their families, which will mean different things but is important for people with intellectual disability, have increased choice and control. Having choice and control is not simply getting what you want in a very simple sense, and fundamentally depends on knowing what is available, knowing the quality of what is available, and having expectations about how to live well. So if people are choosing to do things perhaps contrary, or their family members are choosing to do things with them and for them, contrary to perhaps people living well within the community, that's not choice and control. The choice and control ideally assumes that people have rights, have an understanding of that, and will make decisions about the best support they possibly can. How do they get that information? That is one of the gaps at the moment. I don't think there is good understanding for people with intellectual disability or people with disabilities generally. I think service providers are struggling to present what it is they actually do in the way, if we were looking to purchase a product in another way, even to go to allied health services. If you go to the dentist, you have an assumption that all of the dentists can do certain sorts of procedures, or they tell you if they can't, hopefully. We also have an assumption that those people will be trained up to a certain level. We don't have to work out if they're any good. The assumption is if they're there in the marketplace, they're providing a good product. It's up to us to choose if it's what we want, if it's where we want, if we like the people. I don't think that level of assurance is there yet for people with intellectual disabilities and their families to be, if the aim is to be a good consumer, I don't think that has been established yet. So choosing is one thing, having good information on which to base your choice is critical.